Top 5 vitamin to stop frequent urination. At night, lower blood sugar. Health Aura. Know it right. Live it light. Have you ever wondered why some nights you keep waking up, again and again, just to visit the bathroom? For many people with diabetes, this can be an exhausting routine. But here's an intriguing thought. Could the right vitamins help change that? Research now shows that certain vitamins play a vital role in keeping your kidneys healthy, balancing fluid levels, and even stabilizing blood sugar, all of which may help reduce those disruptive nighttime trips. What's more surprising is that a deficiency in these key nutrients might actually be making the problem worse. Are you unknowingly missing out on the very vitamins that could improve your sleep and overall well-being? In this video, we'll explore which vitamins can support better bladder control and simple ways to add them to your daily routine. Ready to reclaim restful nights? Let's dive in. 1. Vitamin B6. The silent key to restful sleep, bladder control, and kidney protection in diabetes. Have you ever laid in bed, finally beginning to drift into sleep, only to be pulled awake again and again by the urgent need to visit the bathroom? For many people living with diabetes, this exhausting cycle of nighttime urination quietly steals away restful sleep, leaving the body fatigued and unrefreshed. But what if one simple, often overlooked nutrient could help ease this burden? That nutrient is vitamin B6, a silent ally working deep within your body to support the nerves, balance blood sugar, calm inflammation, and protect your kidneys, all of which influence nighttime urinary patterns. Vitamin B6, also known as pyridoxine, plays a critical role in maintaining the health of your peripheral nerves, including those that control bladder function. In diabetics, prolonged high blood sugar can damage these nerves, leading to urgency, frequent urination, and incontinence, symptoms that often worsen at night. By aiding in the production of neurotransmitters, vitamin B6 helps preserve nerve integrity, allowing the body to maintain smoother, more controlled bladder signaling. Yet the influence of B6 extends even further. It is a key player in glucose metabolism, assisting enzymes in breaking down glycogen to stabilize blood sugar levels. Without adequate B6, glucose tolerance declines and insulin resistance worsens, creating dangerous spikes that lead to osmotic diuresis, when excess sugar forces the kidneys to excrete more water, driving frequent urination. Clinical trials show that supplementing with B6 can improve insulin sensitivity within weeks, providing metabolic support that indirectly eases the strain on the bladder. What's more, vitamin B6 plays a protective role in kidney health, helping to prevent inflammation and preserve filtration efficiency, an essential function since declining kidney performance can further contribute to nocturnal urine production. And while supporting blood sugar and kidney function, B6 also influences sleep itself by boosting serotonin production, helping diabetics achieve deeper, more restorative rest, something that frequent nighttime awakenings so often disrupt. All of this is especially important because B6 deficiency is common among diabetics due to higher urinary losses, medication effects, and dietary gaps, creating an unseen cycle where poor nerve health and unstable blood sugar worsen bladder control. By correcting this deficiency, often with 25 to 100 milliliters of B6 daily under medical guidance, improvements in nerve signaling, glucose regulation, and kidney resilience can unfold gradually over 2 to 3 months, restoring more peaceful nights. In this way, vitamin B6 offers a gentle, multi-layered intervention for reducing nighttime urination, one that touches nearly every system involved in the process. This content is essential to be universal in the nursing home and the clinic, where supporting restful sleep and improving quality of life for those with diabetes is a daily priority. By embracing this simple but powerful nutrient, we may help many reclaim the comfort of uninterrupted nights and brighter, more energized days. 2. Vitamin D. The hidden light that calms blood sugar, strengthens bladder control, and shields the kidneys from diabetes. Have you ever noticed that no matter how well you manage your diabetes, you still wake up at night needing to use the bathroom? The culprit might not be your bladder or kidneys alone. It could be something as simple, yet profoundly important, as your body's vitamin D levels. Far beyond its well-known role in bone health, vitamin D is a silent regulator of blood sugar, bladder function, and kidney performance, the very systems that control nighttime urination. When vitamin D is optimal, insulin works more efficiently, helping the body maintain balanced glucose levels. But when vitamin D is deficient, as it often is in people with type 2 diabetes, insulin resistance worsens, blood sugar control declines, and the body begins to suffer the consequences of elevated glucose. One of those consequences is osmotic diuresis, where high blood sugar draws water into the urine, leading to frequent trips to the bathroom, especially at night. But that's only part of the story. Vitamin D receptors are also found in the bladder itself, helping to regulate muscle tone and nerve control. Low vitamin D impairs this delicate balance, weakening bladder muscles and increasing urinary urgency and frequency. Even more fascinating is vitamin D's role in controlling vasopressin, a hormone that helps the kidneys conserve water during sleep. Without enough vitamin D, vasopressin can't do its job effectively, causing the kidneys to produce excess urine at night. Multiple studies now confirm this connection, with research showing that people with low vitamin D levels are significantly more likely to suffer from nocturia. But the kidneys themselves are also highly dependent on vitamin D. This nutrient helps modulate the renin-angiotensin-aldosterone system, which governs blood pressure and fluid balance. A deficiency in vitamin D disrupts this system, worsening kidney function and promoting fluid imbalances that drive more nighttime urination. Moreover, vitamin D supports pancreatic beta cells, helping them produce insulin more effectively, while also calming inflammation that damages the urinary tract and kidneys. Unfortunately, vitamin D deficiency is common in diabetics due to limited sun exposure, higher body fat, and kidney impairment. Correcting this deficiency can be life-changing. For most adults, 600–800 IU daily is a starting point, but for diabetics, or those with severe deficiency, 1,000–2,000 IU daily or short-term high doses may be recommended. Improvements in blood sugar regulation and urinary patterns typically begin within 4 to 6 weeks, though reducing nighttime urination may take up to 2 to 3 months. In essence, restoring optimal vitamin D levels offers a simple, powerful tool to harmonize blood sugar, kidney function, bladder health, and hormonal balance, dramatically improving sleep and overall well-being. This content is essential to be universal in the nursing home and the clinic, where restful nights and metabolic stability are vital for quality of life. By understanding and embracing the power of vitamin D, many can finally reclaim the peace of uninterrupted sleep and wake to brighter, healthier days. 3. Vitamin A, the unsung protector of blood sugar, bladder health, and restful nights for diabetics. Have you ever stopped to wonder what keeps the body's delicate systems, blood sugar, kidney function, and bladder control, working in quiet harmony, especially through the night? One key player, often overlooked, is vitamin A. Far beyond its reputation for supporting vision and skin, vitamin A performs vital roles in the very mechanisms that help diabetics experience deeper sleep with fewer interruptions. Deep within the pancreas, vitamin A nourishes and protects the beta cells, the precious insulin-producing cells so often damaged in diabetes. By maintaining their structure and function, vitamin A helps stabilize insulin output, easing the burden on the kidneys and preventing the excessive urine production that disrupts sleep. But its influence doesn't stop there. Vitamin A fortifies the epithelial linings of the bladder and urethra, creating a protective barrier against irritation and infection, both common culprits behind nocturnal urinary urgency. When vitamin A is low, these linings become vulnerable, inviting discomfort and increasing nighttime urges. Its antioxidant power also shields the kidneys and bladder tissues from the oxidative stress that accelerates diabetic complications, helping preserve kidney filtration and fluid balance. In fact, observational studies link higher vitamin A intake to lower rates of kidney dysfunction and better overnight fluid retention, translating to fewer nighttime awakenings. Meanwhile, vitamin A's influence on the immune system adds yet another layer of protection. By enhancing immune defenses and calming chronic inflammation, it reduces the risk of recurrent urinary tract infections that so often plague diabetics and worsen nocturia. Even at the level of hormone regulation, vitamin A quietly shapes water balance through retinoic acid, which modulates kidney reabsorption of water. A deficiency here can tip the scales toward excess urine production, yet when vitamin A is replenished, this hormonal balance is restored. For most adults, a daily intake of 700–900 micrograms is sufficient, though therapeutic doses may be used under guidance. Benefits to blood sugar, bladder comfort, and kidney health typically emerge within 6 to 8 weeks, with full effects developing by 3 months. This content is essential to be universal in the nursing home and the clinic, where even subtle improvements in nighttime urinary control can dramatically enhance quality of life. In the journey of diabetes care, vitamin A proves itself to be a quiet yet powerful ally in the quest for restful nights and healthier days. 4. Vitamin C, the bright shield for vascular health, blood sugar balance, and nighttime bladder comfort in diabetes. Have you ever considered that something as simple as vitamin C could hold the key to more restful nights and steadier blood sugar control? While most people associate vitamin C with immune health, few realize its profound effects on the delicate vascular and urinary systems, particularly in those with diabetes. In diabetes, persistently elevated blood sugar damages the endothelial lining of blood vessels, impairing circulation to critical tissues, including the kidneys and bladder. Without proper blood flow, these organs struggle to perform their roles in fluid balance and filtration, contributing to the all-too-common problem of nocturnal urination. Vitamin C helps reverse this process by promoting collagen synthesis, which strengthens vessel walls while neutralizing oxidative stress that accelerates tissue damage. As blood vessels heal and circulation improves, the kidneys are better able to regulate urine concentration and reduce nighttime output. But the benefits extend even further. Vitamin C is a potent anti-inflammatory agent, lowering the chronic inflammation that disrupts insulin signaling and irritates the bladder wall. When inflammation is tamed, both glucose metabolism and bladder muscle tone improve, easing urinary urgency. Clinical studies reveal that individuals with higher vitamin C intake experience notable drops in fasting glucose and oxidative markers, both key drivers of overactive bladder symptoms. In one randomized trial, diabetics taking 1,000 milliliters of vitamin C daily for 6 weeks showed measurable gains in blood sugar stability and reduced episodes of nighttime urination. Moreover, vitamin C enhances nitric oxide production, promoting healthy blood flow through the kidneys and supporting their ability to concentrate urine more effectively during sleep. This translates to fewer nocturnal awakenings and deeper rest. Another overlooked benefit is vitamin C's role in protecting against urinary tract infections, a frequent and disruptive problem for diabetics. By boosting immune defenses and slightly acidifying the urine, vitamin C helps inhibit bacterial growth, reducing bladder inflammation and sensitivity. This content is essential to be universal in the nursing home and the clinic, where reducing nighttime bladder distress can dramatically improve quality of life. On the metabolic front, vitamin C supports enzymes involved in carbohydrate metabolism, easing pressure on the pancreas and reducing the likelihood of glucose spilling into the urine, a common cause of polyuria. With regular use, many diabetics find that vitamin C offers a gentle but effective way to support blood sugar control while minimizing bladder stress. For most, a daily intake of 500 to 1,000 milliliters is well tolerated, with improvements typically emerging within 4 to 6 weeks, and clearer urinary benefits within 2 to 3 months. As a water-soluble vitamin, excess amounts are usually excreted, though those with kidney issues should consult a healthcare provider before starting supplementation. When guided appropriately, vitamin C becomes a powerful ally in the diabetic journey, helping restore balance between vascular health, metabolism, and bladder comfort, making peaceful, uninterrupted nights far more attainable. 5. Vitamin E, the silent guardian of nerve health, blood sugar stability, and nighttime bladder control in diabetes. Have you ever felt that no matter how carefully you manage your blood sugar, certain complications seem to creep in, like restless nights interrupted by the constant urge to urinate? Often, beneath these symptoms lies a deeper imbalance, driven by something as insidious as oxidative stress. In diabetes, chronically high blood sugar creates an excess of free radicals that damage the body from within, attacking blood vessels, nerve fibers, and vital organs. This is where vitamin E, a powerful antioxidant, becomes an essential ally. By neutralizing harmful molecules, vitamin E protects delicate nerve tissues, including those responsible for controlling the bladder. When these nerves are damaged, as in diabetic neuropathy, the result is poor bladder control and increased nighttime urination. By preserving nerve integrity, vitamin E can help reduce this cascade of symptoms. Yet its benefits extend even further. Vitamin E also enhances insulin sensitivity by stabilizing cell membranes, allowing insulin receptors to perform more efficiently. This promotes better glucose uptake and overall metabolic balance. Clinical trials have shown that supplementing with 400 IU of vitamin E daily for several months can lower fasting glucose and HbA1c levels, supporting more stable blood sugar and reducing the likelihood of osmotic diuresis, a common cause of excessive urination. In fact, diabetics with higher vitamin E levels often report better glycemic control and fewer urinary symptoms, including nocturia. But the story doesn't end with blood sugar and nerves. Vitamin E is also a protector of kidney health. Chronic inflammation in the kidneys impairs their ability to concentrate urine, resulting in greater fluid loss overnight. Vitamin E helps calm this inflammation and preserve kidney filtration, slowing the progression of diabetic kidney complications. Studies have even shown that vitamin E reduces proteinuria, an early marker of kidney damage, reinforcing its role in supporting healthy renal function. With improved kidney performance comes better fluid regulation, directly lowering the frequency of nighttime bathroom trips. Additionally, vitamin E contributes to nervous system relaxation and reduces oxidative damage in the brain, promoting more restful sleep and fewer awakenings driven by bladder discomfort. Its role in modulating nitric oxide also improves blood flow to both the bladder and kidneys, further enhancing their function and reducing overactivity. This content is essential to be universal in the nursing home and the clinic, where supporting nerve health, blood sugar stability, and restful sleep dramatically enhances quality of life for diabetic patients. For most, maintaining daily vitamin E intake through food sources 15 or 22.4 IU is a baseline, while therapeutic doses between 200 and 800 IU may be used under medical supervision. Results often begin to appear within 6 to 10 weeks, with full benefits for nighttime urinary symptoms emerging over 2 to 3 months. Of course, those with diabetes should consult their healthcare provider, as excessive vitamin E intake can affect blood clotting. When used properly, however, vitamin E stands as a gentle but powerful guardian, helping diabetics reclaim their nights, restore energy, and improve overall well-being. Tech 3. Delicious meals to support diabetic health and ease. Nighttime urination. Let's explore 5 delicious meal ideas rich in vitamins that can support better blood sugar control, promote kidney and bladder health, and help reduce those disruptive nighttime bathroom trips. First, consider grilled salmon, an outstanding source of vitamin D, which is vital for maintaining healthy kidney and bladder function. Grill the salmon to tender perfection and serve it alongside roasted asparagus, known for its natural diuretic properties, on a bed of crisp mixed greens. This meal not only enhances insulin sensitivity, but also encourages balanced fluid regulation, helping minimize nighttime urination. Another powerhouse dish features sweet potatoes, packed with vitamin A to reduce inflammation and improve kidney performance. Bake a sweet potato and pair it with steamed Brussels sprouts, whose fiber content supports digestion and helps manage fluid retention. Add grilled chicken breast for a boost of lean protein to stabilize blood sugar. A perfectly balanced plate to promote healthier fluid balance and fewer nighttime disruptions. For a lighter option, a citrusy chicken salad makes a refreshing choice. Toss together lemon and orange slices rich in vitamin C, creamy avocado, and hydrating cucumber. This vibrant combination supports blood vessel and kidney health, while the cucumber helps the body manage fluid retention, reducing the urge to wake up at night. A nourishing smoothie is also a smart addition. Blend avocado, loaded with vitamin E, with fresh spinach and flax seeds for added fiber and anti-inflammatory benefits. This powerful drink supports kidney health, reduces oxidative stress, and helps regulate fluid output, all key to minimizing nighttime urination. Finally, a comforting red rice and lentil stew provides a hearty source of vitamin B6, essential for nerve function and fluid balance. Serve the stew with a side of roasted turkey, which further supports stable blood sugar and kidney performance, helping ease urinary symptoms overnight. By incorporating these nourishing, vitamin-rich meals into your routine, you may find yourself enjoying deeper, more restful sleep and better overall health. If you found this video helpful, please give it a like, share it with friends or loved ones who might benefit, and subscribe for more simple, life-changing health tips. Have questions or personal experiences to share? Drop a comment below. I'd love to hear from you. Until next time, stay well and stay empowered on your health journey.